COVID-19 vaccination efforts. Support your employees in getting vaccinated. Sponsored by the Salt Lake Chamber's Roadmap to Recovery Coalition and the Economic Development Corporation of Utah. I'm Mikelle Moore. I'm one of the chairs of the Roadmap to Recovery Coalition, and I'm also Senior Vice President and Chief Community Health Officer for Intermountain Healthcare. We're excited to share more today about the options available to your business regarding the distribution of COVID-19 vaccines, including volunteer opportunities, partnership opportunities with mobile clinics, and the activation of existing on-site clinics. During the webinar, we're going to try to answer some of the questions we've been hearing most commonly from businesses. What volunteer opportunities exist through the state and through local health departments? How can I get my employees vaccinated as soon as possible? How can my business support vaccination efforts? Can I host a vaccination clinic or an event at my office? And where can my employees go to locate a vaccine? Today, we're joined by Teresa Foxley, President and CEO of EDC Utah, and she will serve as our moderator today. We're also pleased to have Lieutenant Governor Deidre Henderson joining us today, and she'll be making a few remarks. Jill Parker is the Executive Director of the Utah Association of Local Health Departments, and Nikki Campbell is the Director of Organizational Development and Performance Improvement for the Utah Department of Health. These have become my fond friends during the pandemic, and I'll be a part of the panel as well. It should be an informative session. If you have questions during the presentations and remarks, please feel free to submit a question using the Q&A function. We're going to do our best to answer as many questions as we can. This webinar is being recorded and will be made available on the Salt Lake Chamber's website. We're first going to hear from Lieutenant Governor Deidre Henderson, followed up by a Q&A session led by Teresa Foxley. So with that, it's my pleasure to turn the time to Lieutenant Governor Henderson.
Well, thank you so much. It's really a pleasure. It's an honor to be here. I appreciate what this is all about, and I appreciate that that you guys are all interested in helping out and figuring out what you can do to help in these efforts. This vaccine effort is the most important thing that we can be doing right now. I just was elected last November to be Lieutenant Governor. I was in the state Senate before that. But after taking office in January this year, this has been the biggest lift, the biggest effort, the most important thing that we've done. I personally haven't been involved heavily in the pandemic response over the past year. It wasn't until this vaccine effort started happening when I was elected and after inauguration. And so I feel like it's kind of cheating a little bit, because all of the really hard stuff, the difficult decisions, the stuff that nobody wanted to do, the stuff that all of you at the business owners and everybody has had to deal with, I haven't had to deal with those, and I get to come in in the fourth quarter, so to speak, and help out with the hope, and that's what these vaccines are. It's hope. It's hope to be able to get back together with the people that we love. It's hope to be able to get our businesses flourishing and back to normal, and be able to associate and travel and do all of the things that we have been restricted from doing largely over the past year. So I'm grateful for that opportunity. I have a few updates that I would like to give you. The governor and I just finished a press conference, and we had our weekly press conference, and I'll give you a few updates from that, and talk about a few things, and then I would love to just answer some questions if I can. So first of all, the big news really is that we are really, really close to hitting the 1 million mark for vaccines in the state of Utah. And now that's first and second doses. So that's not 1 million people. It's the combined first and second dose, but it's still a really big deal. So we so far have administered 936,681 doses of vaccine in our state. Now that number is up from last Thursday, it's up over 151,000. which is huge. So 151,000 doses administered in 1 week is a really, really big deal for our state. It's by far the biggest week that we've had. And yesterday was by far our highest number of doses administered in one single day. And that was 34,290 doses that were administered yesterday. Now, there are a lot of people helping out in this effort, but I have to give a shout out to our local health departments. Our local health departments, there's 13 of them throughout the state. And these are all things that I learned when I got into office 2 months ago. So you all probably already know all of this stuff, but I've done a lot of learning over the past couple of months. And so if you don't already know this, don't feel bad. I didn't know it either. But we've got 13 local health departments, and some of them are county specific, some of them are multi-county. But you know, these folks are public health leaders and public health workers who are the boots on the ground in our communities year in and year out. And they do all of the things that keep us as a public safe. But when we got into office in January, we pretty much immediately kind of shifted the burden of vaccine distribution entirely onto their shoulders. And this is something they do. They administer vaccines all the time. They're very good at it, which is why we wanted them to really take this upon their own shoulders. But never to this extent. This was a really big lift. So I spent the first couple of weeks in office traveling around the state. Jill Parker, she's here with the Association of Local Health Departments, and she came with me, and Rich Saunders, our executive director of the Department of Health. We went and visited all 13 local health departments to find out what they needed. What were the difficulties that they were experiencing? How could we help them be successful in administering doses of vaccine into people's arms within a week of getting those doses, so that we didn't have things sitting on a shelf, and we could get the people who needed it the most vaccinated quickly. And really, it was an incredible effort. As you know, some of you may have wished that we prioritize different groups of people. We get bombarded all the time with people saying, hey, we need you to prioritize this group or that group or these essential workers or those essential workers. And we really eliminated all of that, because what we want is to make sure that the people who are at the highest risk of getting severely ill, becoming hospitalized, or even dying from COVID-19 are those that get the shots first. And so we've really prioritized based on risk factors. And of course, we did have first responders and healthcare workers and our teachers, our educators, able to get those shots, and that was really important. But other than that, we have just been focusing on age and comorbidities. And so as of today, 79% of Utah adults that are over the age of 70 have received at least one dose of the vaccine. 79%. Now, that's huge, because we're not requiring people to get shots, and we won't require people to get shots. We never will. And not everybody's going to want to get them, but that almost 80% is huge uptake. That is really, really important. 64% so far of people between the ages of 65 and 69 have also received at least one dose. That is also a big deal. We've only been doing 65 to 69-year-olds for a few weeks, and 29% of our 50 to 64-year-olds have received at least one dose. And again, this is a new category that just opened up this week. So already 29% have received at least one dose. We are really excited about this, and we expect our millionth dose to be administered in the coming days. It's going to be really hard for us to tell you exactly when that is, but it is coming quickly. We also have been focusing really heavily on making sure that we have what we're calling vaccine equity. We want to make sure that the doses that are administered in people's arms actually reflect our population, because it might be really easy and accessible for a lot of people to get the vaccine, but it might be really, really hard for some segments of our state. And we want to make sure we're not leaving anyone behind. So we've been working very closely with our local health departments on that, and other partners as well. I want to leave time for questions. Just really quickly, we do have need for volunteers. We put out a call for volunteers a few weeks ago. We had over 4,000 people sign up to volunteer. The onboarding process is maybe a little bit cumbersome at times. You got to kind of go through some training and fill out paperwork and all sorts of things. It might take a little bit of time, but it's really important for us as we get more doses from the federal government allocated to the state of Utah. We really will need these volunteers. And if you want to volunteer, you can go to utahresponds.org. That's utahresponds.org to sign up for to help with these vaccination efforts, especially probably in some of these more vulnerable populations and in our mass vaccination clinics when we have enough doses to actually stand those up. So I'm happy to answer any questions if there are any.
Lieutenant Governor, that was an absolutely terrific summary of where we are, where we've been, and hopefully where we're going here in the next couple of weeks. So thank you so much. Really, for you to have hit the ground running like this and to now have such a great, to now be approaching our millionth dose administered is something that I think we can all celebrate. So thank you. I am not seeing any Q&As in the, let's see, 2 questions. Yes, Josh Brown, you have 2 questions from Rio Tinto. Josh, can you pop those in? Oh, excellent. Josh, text me. Oh, okay. So this is a great question, and one I think may have been addressed in an earlier press conference today. But for those of us who weren't able to participate or watch that live, is our target date for opening up the eligibility criteria to all Utahns over the age of 16 or 18 still April 1st?
Yes, it is. That is our target date. Now, that could change based on vaccine availability. So we are not in control, unfortunately, of vaccine manufacturing or allocation to our state. We take what we get. And every week for the past, I don't know, month, we've been expecting a big number, a big increase from the federal government in what they give to the state. And it's just been this slow trickle. Unfortunately, we've been waiting and ready and we're ready to go, but we haven't gotten those huge allocations yet. And we were just told this week, we have a White House call every Tuesday. And we were told this week that we probably won't get those for a couple of weeks. So yes, as it stands today, we expect that by April 1st, we will open up vaccine eligibility to everyone. And everyone over the age of 16. Of course, 16 and 17-year-olds are only approved for the Pfizer vaccine. So that you'd have to, if you have a 16 or 17-year-old that you want to get vaccinated, you got to go to a clinic that does Pfizer. But other than that, everyone else, it will be open by April 1st.
Thank you, Lieutenant Governor. I'm really hoping that we can hold with that date and we'll all keep our fingers crossed.
Well, look, the governor has made a commitment. It might be earlier if we get lots and lots of vaccine doses, but it's not going to be later. You can take April 1st to the bank.
All right. Excellent. Thank you. I had another question come through related to volunteerism. Thank you so much for providing the utahresponds.org website. Any additional or further thoughts on ways that businesses can help facilitate volunteerism of their employees?
Well, I think, and maybe Jill can speak to this as well, Jill Parker, but these efforts, of course, we have a statewide effort with Utah Responds, and then of course our local health departments, have some of their own their healthcare workers that they have their volunteer systems for. And of course, Jill, I'm forgetting what that's called off the top of my head, but it's called something anyway.
So Medical Reserve Corps, Lieutenant Governor.
Sorry, what was that?
Medical Reserve Corps.
Yes, thank you. And so, you know, I would have them contact the local health departments or just go and sign up with utahresponse.org. And that's really, we really need people to be onboarded and waiting in the wings for when we need them. We may not need people immediately just because it's all based on when we get those doses. But it can be a little bit of a cumbersome process, especially depending on what county you live in. And so having that taken care of now, if you have employees who want to become volunteers, having them get enrolled right now is probably a really good thing to do so that when we're ready and when we need people, they're ready to go.
Excellent. We'll take that as a call to action, Lieutenant Governor.
Great.
Those employers that are on the call who want to be part of the solution here, do direct your employees to utahresponse.org, get them onboarded, and let's get them in the queue. Well, Lieutenant Governor, I know that you had that you needed to transition to some other responsibilities. Want to thank you so much for spending your time with us today. Thank you for the great update and report, and know that we're all supporting, we all want to be supportive of this and of you as we continue to roll out this amazing medical miracle. So thank you.
Thank you. Thank you for what you guys do.
Terrific. I'm very much looking forward to the rest of our conversation today, and thanks and are so grateful to be joined by Jill Parker, who runs the local health department association. Jill, great to see you. Great to have you. Nikki Campbell, the director of operational performance for the Utah Department of Health, who's had her hands in so many different elements of the state's COVID-19 response. And of course, Mikelle Moore with Intermountain Healthcare. What an amazing group of panelists here today. Thank you so much for letting me ask you a couple of questions. Jill, I know you wanted to display some information that would be helpful to this group. So why don't I turn the time over to you, and we can have you share your screen with some of the ways in which, again, we're trying to answer these key questions here. How can we help through volunteerism? What is the best, quickest, fastest way for me to get my employees vaccinated? And what resources exist for employers on that front? So Jill, take it away.
Okay, thank you so much, Teresa. The Lieutenant Governor did a great job of providing an overview of local health departments and how we are kind of set up across the state, across the 29 counties. There are 13 of us. We could not do the vaccine rollout without our partners at Utah Department of Health, Nikki and her team, and also with our external partners. IHC and Mikelle have been just so fabulous in helping us, and Nomi and you and our U of U partners. I just wanted to share, there have been a few questions about on-site clinics and mobile vaccination units being deployed to work sites. Right now, from a local health department perspective, we are very focused still on high throughput. That's been, and the priority populations. That's been the direction that we've been given. As more vaccine, and to the Lieutenant Governor's point, there's not as much vaccine as we had hoped at this point. But with the limited vaccine that we are getting, we are still very much focused on those high throughput sites that allow large groups to come through and be vaccinated. While doing that, though, we want to be very thoughtful about making sure that within those priority populations, we're reaching all corners of our counties across the 29 counties and the 13 health districts. And so we'll see partnerships with Meals on Wheels assuring that those 70 plus are getting vaccinated. Teams going to long-term care facilities to assure that new admits are receiving their COVID-19 vaccine. But let's talk a little bit about what this looks like for employers. So right now, with health departments still being so focused on high throughput sites, the ability for us to be mobile right now is a little bit tricky. I think as more vaccine becomes available and those populations open more, that there will be more opportunity for local health departments to be mobile. Utah Department of Health also has mobile assets, and I'll let Nikki talk about that. But here's this screen that I just, I'm going to share quickly with you. from the utahcoronavirus.utah.gov. And I would be remiss if I didn't give a shout out to our amazing communication partners for setting up this website so quickly early on in the response, and then managing it throughout the response. But we know there's a lot of information here and it can easily be lost. And so I'll put this link also in the chat so that you have access to it. But this may be a resource to put in an email to employees or through an employer newsletter. It highlights not only, and this is updated regularly, so it not only provides who is eligible for the vaccine now, but also where they can get vaccinated. Local health departments have been that place for quite some time and were the only place that vaccinations were really offered. Now that's expanding a little bit to local pharmacies and external partners like NOMI, and through providers like IHC and U of U. So on this site, you can see the local health department links, and it also provides a place over here, a map, where individuals that aren't sure what their local health department is can see by county kind of where they fit. And then if you click on these live links, it'll take you right to the local health department webpage, their COVID vaccine webpage, and allow you to schedule through their scheduler. Additionally, below here, you'll see that the healthcare providers are outlined, and they have their vaccine scheduler links to their schedulers also available. And then finally, those that local pharmacies right now that also have vaccine. So this page is kind of a one-stop shop for how to get your vaccine. So until there is more vaccine available, more populations are open, and we can do more mobile clinics, this may be something in the interim, as now we're open to 50 plus. So Teresa, I hope that was helpful. I'm happy to take any questions or.
Jill, very helpful. Thank you so much. Lots of different options depending on where individuals live, and a great resource for employers to push out is that website, which is now in the chat, coronavirus.utah.gov/vaccine distribution. Really, really terrific. Thank you so much for that update, Jill. And I think that's helpful information for all that are on the call. Maybe I'll transition over to you now, Nikki, for any additional thoughts or perspective from the State Department of Health. And perhaps we can start to tease out this mobile on-site clinic issue as well. So take it away, Nikki.
Thanks, Teresa. And thank you, Jill, for that excellent overview. Yes, as Jill mentioned, the state of Utah has contracted with 4 mobile providers, NOMI Health, Community Nursing Services, Red Rock Pharmacy, and Hurricane Family Pharmacy, which serves the lower southern part of the state. And these resources will be available with about, we believe, starting off with a capacity of about 13,000 doses per week. So it's really not very many, as Jill mentioned, compared to all of the many employees that you guys have that you're trying to protect. So for beginners, we will be prioritizing those populations that Lieutenant Governor and Jill mentioned, with whoever the vaccine is open to, as well as those with comorbidities. But clearly, as this opens up further, it will be a lot easier to coordinate these and get your employees in, at which point we would prioritize it based on health inequities that we see often. So I think many of us are familiar with some work sites that may be just at higher risk. You're not able to telework, you have many racial and ethnic minorities, or you have a lot of uninsured employees. Those would be the types of workplaces that we would deploy these assets to first. I know there was a chat about business size or types of businesses. So it would clearly be very helpful if at first we could do larger clinics with as many people as possible, just to reach as many as possible. But we love and appreciate small businesses as well. And we do believe that in the future, there would be opportunities to coordinate with small businesses. I actually just got a text from somebody considering mobile vaccination events as well, saying, okay, so let's think through, if we're not able to reach everyone, how can we quickly get doses used within the 7 days that they are expected to utilize doses for? And that could be a great opportunity to connect with small businesses to kind of fill those slots. So I appreciate you bringing this up and helping us think through this. That being said, we do believe that there will be mobile availability to be able to help everybody that we can and reach all parts of the state. We really want to focus on rural and frontier to begin with. The main question is just time. Some of these could be as far as 6 months out. So your best bet may be something that we discussed later on in the call with perhaps onboarding if you have an on-site clinic at your workplace, or using the tool that Jill just showed to find areas where they do have available vaccine. But in any event, we would love to be able to help get your employees vaccinated, and we are so appreciative of you all for communicating this to your employees as well.
Thank you, Nikki. I'm going to ask you a follow-up question, which relates to those employers who already have an on-site clinic. Those who may have a PA, a nurse, or an MD that is servicing their employee base. Will there be an opportunity for those clinics to have a vaccine day? And what does the prioritization look like for those companies?
Yes, that is a great question, Teresa. Early on, we heard from many businesses that have on-site clinics, and I know a few people who work at places that have on-site clinics, and that is really where they get a lot of their primary care. That's where their trusted provider is, and it's just so convenient for them to be able to access healthcare at their work site. We certainly want to enable that. The issue we have run into at this time is exactly what Lieutenant Governor Henderson and Jill mentioned, which is the slow trickle of doses that we've received into the state, as well as the eligibility, right? So we had 70 plus, which you probably don't have many employees who are 70 plus or 65 plus. Now that the eligibility is opening up much more, and we are starting to expect more doses, we finally got confirmation yesterday that in the April and May timeframe, we should be expecting a lot more doses into the state of Utah. That positions us really well to get doses to your work sites and your clinics. There is an onboarding process. It takes about 2 weeks. So if you are interested, if you have an advanced practitioner at your workplace who could oversee this effort, and you have employees who are interested, please do start the onboarding process. I can drop the link in the chat. You would initiate it through a Qualtrics survey, and the survey will help you understand if you qualify and meet the minimum requirements. Once you fill out the survey, you would then receive an email outreach from the state onboarding team that would help you navigate the process and get everything over to CDC, and then ensure that you guys are able to receive the vaccine. The longest part of this process is a 7-day temperature log. So perfect timing for everybody to start thinking through this with the 2-week process, get that temperature log started, get it over to CDC so that when we do receive more doses, we could start direct shipping these to those facilities so you can serve your employees quickly.
Terrific. Thanks, Nikki. And maybe just one more follow-up question, which is, yes, those on-site clinics are oftentimes primary care for the employee, but they can also be primary care for the employee and the employee's family. Do the distribution, if those become distribution sites, could they be opened up beyond just the employee base to include family or even other community members if the company wanted to volunteer that as part of the vaccine response?
Yes, absolutely. We are trying to reduce barriers to vaccine as much as possible, right? As Lieutenant Governor Henderson mentioned, this is the most important thing for us to get everything going again, our economy reactivated, and people back to normal. So if we are so appreciative of you all being a part of the solution and providing that service to your employees and their spouses, qualified children over the age of 16 at this time. But yes, there wouldn't be any limitations other than who is eligible, which, as we heard, will be opened up more widely as well.
Terrific. Mikelle, perspective from the private provider. You've obviously been a hugely important part of the state's response to the pandemic through providing terrific care. Your employees have now, those frontline healthcare workers gratefully are able to take advantage of this. But what do you see going forward over the next couple of months?
Well, thanks, Teresa. We are really fortunate. I just want to applaud Jill and Nikki. We are so fortunate to have such collaborative partners who are working, really with the private sector very well. And as you hear from Nikki and the Lieutenant Governor, we're just not seeing the doses yet come into the state that allow us as private healthcare providers to be a real critical part of the solution yet. But that will come very quickly, and we really look forward to that. At this point, Intermountain Healthcare is a provider of several high throughput sites. As Jill mentioned, the focus has been on areas that can really augment the efforts of the local health departments. And so Intermountain is offering vaccine clinics at Logan Hospital, McKay Hospital, Park City Hospital, Riverton Hospital, St. George Regional Hospital, the Orthopedic Specialty Hospital here in Murray, and then Utah Valley Hospital at this point. And we each week with the state look at what vaccine is coming in and whether there are potential to open additional sites or be of additional support and service to our local health departments. For the most part, we're really trying to be augmenting that capability. So we're doing outreach to eligible individuals that we know of who have a health condition that qualifies them or meet age criteria, and really trying to ensure that even while people are self-selecting and reaching in to schedule those visits, we're also reaching to them. So physician offices are calling their eligible patients. We have care managers who are phone calling in English and in Spanish to try to reach people, and Select Health is communicating with their members. And we know our colleagues at the University of Utah are doing the same thing. And we're really trying to be conscientious about how are we reaching those who are most vulnerable, who might not be advocating for themselves as directly as others, to try to augment what our local health departments are doing and so on. But we do anticipate our clinics and our community pharmacies have submitted applications, as Nikki described, to become vaccination sites when the time is right. And we are retraining medical assistants and people who've been involved in the mass testing efforts to transition from their current roles to vaccinators to be ready to do our part in response. So really appreciate the collaboration and the partnership that's going on in our state. And we'll be a part in whatever way we can, whether it's helping local health departments or businesses as we move to the next phases of our vaccine distribution.
Well, thank you so much, Mikelle. And I know as the moderator, I'm really just supposed to ask questions and not add commentary, but I can't help myself. It really is amazing to see the public, private, state, and local collaboration that we've had. I was able to send a report out on a meeting of the critical infrastructure group after Nikki provided an update earlier this week. And one of the respondents, or one of the participants in the group, had forwarded my note along to their legal counsel. It's an international company with significant employees all throughout the country, and legal counsel is tracking the vaccine rollout for every state and said, I'm moving to Utah. So it's pretty encouraging to see that, yes, of course, we all want more doses, but the way that the state has organized itself and this collaboration is really, as shown by that example, an exemplary example. So as you all are thinking about, again, we have this community that is known for wanting to volunteer. Mikelle, you're pivoting your organization towards being ready. That's, to me, a theme that I'm hearing over and over again, is just, we want to be ready to go when those additional doses come through. Any more thoughts on ways, again, that employers or individual employees who want to help? I'm hearing great stories of volunteerism, neighbors who were walking over to their elderly shut-ins to try and get them registered. What are some small ways that people can help? What are some big ways that people can help? And that's a question to everyone in the group.
I'll go ahead and jump in if that's okay. And then Nikki and Mikelle, please feel free to do the same. You know, we've seen amazing things happen in our communities across the state, from San Juan to Bear River to Salt Lake and everywhere in between, where individuals are helping people register. Sometimes having the ability to register or access to the internet has become a barrier we're recognizing. So we know that we've had volunteers out helping individuals register to get vaccine. We've had those helping others that don't have transportation to get to one of the sites, provide transportation. I think UTA right now actually is just launching an initiative to help with free fare to help people get to vaccination clinics. And so all of these pieces coming together are just so important. I would say, related to the small ways that you can help, those they may seem small, but they're huge. They're huge when an individual then who otherwise couldn't get vaccinated is able to. I know a woman went around with an iPad to visit some of those 85 plus in her neighborhood and helped register them to get vaccinated, and then provided transportation with a mask, social distance to get them where they needed to be. So those things all help this vaccination effort. On a larger scale though, I think that if you have vaccinators are at a high premium. It's difficult to find vaccinators. We're so grateful again to our healthcare providers that are helping us. IHC, I know in many of our communities have sent vaccinators over to high throughput locations to help assure that we're getting those doses out as quickly as possible. But those can go through, again, the Utah Responds portal. That's a great place. If you have a large number of employees, or your work site is looking to help in a large way, getting registered through Utah Responds is a key piece to making that happen. And then what happens is local health departments across all 29 counties will put in a request to Utah Responds, and they'll deploy those volunteers out to our local communities based on their area of residence. So, you know, you wouldn't have to travel necessarily across the state. The hope is you would be able to geographically stay kind of where you are. But that's a great hub for us to be able to pull from. I think the hospitals can pull from there moving for, you know, who our partners collectively as a state system can pull from there. So that would be my other suggestion.
Jill, can I ask you a follow-up question? There are, you have a statewide audience on the call today. Are there certain communities that need volunteers more than others perhaps right now? And where might we be able to encourage additional volunteerism?
You know what, I'm only going to be able to speak at a pretty high level. I could get more information on this, but I know in the Tri-County Health Departments, so that's Uinta, Daggett, and Duchesne counties, the National Guard is out there right now helping them do immunizations, so vaccinators. But that would be an area where vaccinators would be very welcomed, I believe. So if we're talking about a statewide audience, sometimes in our rural areas, it's difficult for volunteers. Often volunteers will congregate along the Wasatch Front. So as we talk about this whole system of 29 counties and 13 local health districts and reaching every little nook and cranny, again, as we get more vaccine and we have this increased capacity for mobile clinics, it's going to be really important that we have a base of volunteers that we can pull from.
Thanks, Jill. And maybe one additional follow-up. Are there opportunities for desk jockeys like me to learn how to become a vaccinator? Or do I need to have a medical background or a veterinary background or something else to be able to jump in myself?
Oh, I'm going to defer that to Nikki and Mikelle. I am not sure.
Teresa, are you a veterinarian, EMT, or medical assistant?
No, no, and no. I'm a Juris Doctor. I don't think that counts though.
Teresa, I think that maybe you couldn't vaccinate, but we would have a lot of jobs for you at our local clinics, right, Nikki?
Yes, Teresa, we could utilize your skill set in many other ways. At this time, we do have many clinicians around the state who have both volunteered and work at many clinics. And we have also worked with DOPL to expand the criteria for who can administer vaccine. So lucky for some people like me won't be administering vaccine, but maybe helping in other ways, like you mentioned, Teresa. We are going on the 1-year mark for this COVID pandemic. And many of the people who've worked on this since the beginning are the people working on the vaccine clinics now in the local health department. The Utah Department of Health currently does not administer a vaccine, and I am totally saying this from the UDOH side. And it's not solicited from the local health department side. But one thing I've heard, in some local health departments, they do have many volunteers, which is so heartwarming, and there has been an overwhelming response. Something that's very meaningful to the boots on the ground and these people who have been working so hard for so many weeks at the local level. And as your businesses want to be involved, some businesses have been sending some local health departments lunch. And I know it means so much to these people. Some of them have been sending cute little pins and different things. So even if your local health department isn't necessarily in need of volunteers at this time, because we have had such an overwhelming response, which is so wonderful, there are many other ways that your business could be involved. Some others have donated vaccination sites, which has been extremely appreciated. So even if there is not a volunteer need, there are many other ways for businesses to be involved, and we so appreciate it from the public health side.
Awesome, great
Yeah,
to
I would just emphasize that, Nikki. I will say that during the different periods of the pandemic, during the surge or during testing, high volume times, I know both Intermountain and the University of Utah received very generous contributions from our community, from restaurants and other businesses who wanted to say thank you to frontline healthcare workers. And it goes, you just wouldn't believe how far that goes in expressing appreciation and a feeling of community. And so never underestimate the role or the opportunity your business has to make a difference.
Thank you so much, Nikki and Mikelle. I'm reviewing some of the questions that we had thought about as we planned this, and we've covered so many of them. So one, ample volunteer opportunities, whether you have a healthcare training or not, really go through that portal. And for our partners that may be on the line from Uinta, Duchesne, or Daggett County, really encourage your businesses or your circles of influence to do that. But think about ways we can do this at our household or neighborhood level as well. Businesses can support these vaccine efforts by encouraging their employees to access the resources that are available through some of the websites that have been put on, or through these morale boosts that we just heard about, the lunches and encouragement, and making sure that our local health departments, our healthcare workers and others feel that support. We've heard a little bit more about hosting a vaccine clinic or on-site, and we know one that we've got this Qualtrics survey that would need to be completed, or otherwise contacting Nikki. And we've now seen where the state has aggregated all of this vaccine information on the website. So we've answered a ton of questions today. I want to kick it out to the audience for any additional Q&A while we have this terrific panel assembled for any follow-up or additional questions that might have been generated as a result of the panel discussion. Oh, here's two great questions in the Q&A. So Nikki, you chatted about, or you discussed earlier, there's about 13,000 or so doses that will be allocated to mobile units. We anticipate that in the early stages of additional capacity, those mobile units will be deployed towards our hard to reach populations. Ultimately, they may be available to businesses. And of course, there will be a prioritization process based on that. How can a business understand if they qualify to be higher on the distribution list? What will the Department of Health evaluate to determine when those units might be able to be sent out to a business?
Gosh, that's such a good question. As I mentioned, we just confirmed the next bump from Health and Human Services yesterday. So we are in the process of building this out. One thing that we want to do that is very important to us is that we closely collaborate with local health departments as well, as they know their local communities and needs better than anybody else. So we're still building that process, but what we will be looking for initially is exactly what you touched on, Teresa. Those with health inequities that have been spotlit throughout the pandemic, and areas where they don't have those mass vaccination sites that Mikelle touched on, or a lot of access to vaccine now. As we kind of finish up with those areas, then the prioritization and criteria could change. If you guys do have work sites that you feel check those boxes at this time, definitely send them our way. And then we can also send, as this is solidified perhaps next week, the criteria to you all, and then we can start getting those lists from you guys and getting them in the queue.
Awesome. Thanks, Jill. Anything to add from the local perspective?
No, I think Nikki did a great job. I do think that as she said, as local health departments are identifying populations that are hard to reach, that in some instances they already are mobilizing to go there. I know there was a plant in one area of our state that had over 130 individuals, 65 plus. They were shift workers and so unable to meet the time frame of the high throughput clinics. And so they did a mobile clinic to that work site. And I think they ended up vaccinating 137 or 139 people at that site that fit into the priority groups that would have otherwise not been able to be vaccinated. And that's some of the things that our local health departments are looking at within their counties. Public health is just that, it's public, and without partners, it doesn't happen. And so they, in local health departments, just as we are on a state level with our partners, they work very closely to make sure that they're reaching all populations. And so if you have those in the existing priority groups, if you have work sites that are for some reason unable to get to a high throughput location, reach out to your local health department. You can reach out to me. I can put my phone number. I'm happy to put my phone number in the chat. If we're missing something there, please let us know. I know that the high throughput locations, they do shift their hours around where they are open on Saturdays. Many of them are going into the evenings now to allow for more employees, especially for the 50 plus, now that that population is open, to be able to access those clinics. So I'll put my number in the chat for anyone that may want to reach out.
Well, thanks for making yourself accessible, Jill, and really appreciate everyone's efforts to bring public health to the public. Got one additional question here that's maybe a follow-on to this sort of notion of on-site clinics, but can small businesses pool together with other small businesses, maybe in their same geographic area or their same industry, for an on-site mobile unit or location? Thank you for the question, Jacob Stone.
I was waiting a second for Jill because we're working so closely on this. One thing Jill made me think of, and as we're starting to connect with those vendors, they are very interested in where would you like us to go, because they really want to meet the needs. So we really will be relying on you all to tell us where we can host these. It would be very helpful to open up these sites. So I think, yes, that is a wonderful idea. Bring together 100 or 250 people or 500 people to one place and get the resources there. I think that would be very welcomed and very helpful. So yes.
Terrific. Well, thank you so much, Nikki. Thanks, Jill. And I think we've sorted through all of the questions in the chat. So really appreciate our audience participation for asking great questions. We will sort of turn to final wrap up. Any final thoughts as members of this panel, or final messages that you'd like the business community to receive as you've got their attention today? Mikelle, why don't we start with you, and then Nikki, and then Jill, if you could wrap us up, that'd be terrific.
Well, thank you, Teresa. I guess I would like to share thank you to our business community. We're really fortunate that we've had a relatively strong economic recovery, even while we're going through the physical recovery and moving into the vaccine phase. And you've been tremendous partners in keeping our community safe by adapting your business practices to follow safety guidelines and make all of the appropriate accommodations. And I just want to encourage us to stay that course. We are so grateful that we are only at 66 patients in the ICU with COVID across our state right now. And there's a time, I can remember in December being really, really worried that we wouldn't see those low numbers this soon. And just know how grateful the healthcare community is for all of our efforts to respond during the surge and get us back to where we are so that we can focus on vaccination. It's a wonderful place to be. Let's stay the course as we move through these last few months of this discipline process and do all we can to reach everyone and get vaccinated. Thanks, Teresa.
Nikki, any final thoughts from you?
I echo Mikelle's sentiments. Thank you all so much for your hard work in keeping Utah really going throughout this pandemic. As we receive more vaccine, we are just really excited to partner with you all and either onboard your clinics or work together on mobile vaccination or send you to those local health departments and available pharmacies throughout our communities. So we definitely look forward to remaining in touch with you as we continue to vaccinate Utahns and get everybody back to work.
Thank you, Nikki, and thank you, Mikelle. Yes, I echo what you both said. I know that sometimes throughout this year, this 52 weeks now, and it's longer for some of us, it has seemed like maybe our work sites have been forgotten, or that we have not, as local health departments, been as thoughtful as we should have been in what you've had to face over the course of the last year. So let me just say thank you for your patience with us. And we think of you often. We know this has been a heavy lift for everyone in our community, for our teachers, for our children, for our work sites, for everyone in our community. And from local health departments, we're grateful for you. We're grateful for you for staying the course. We're grateful for all of the extra precautions and steps you have taken to assure that your employees are safe. We are grateful for you for being willing to host vaccine sites as we start to see this light at the end of the tunnel. And as to what Nikki said, we do encourage you to stay connected to us and let us know how we can help you. This isn't just a one-way street. We definitely need to hear from you on the best ways to reach your employees. You know them best. So thank you, Teresa and Salt Lake Chamber, for allowing us to be part of this discussion today.
Well, thank you, Jill. It was an honor to be able to facilitate this conversation. And I'm so grateful to Mikelle, and who's leading the Roadmap to Recovery Coalition, for creating this format. So thanks to each one of you. And Mikelle, I turn it back to you.
Well, thank you, Teresa. Thanks for moderating. Really appreciate it. And I'd like to thank Lieutenant Governor Henderson for joining us as well, and to our panelists, Nikki and Jill. I personally am so grateful for your friendship and the collaboration that you've represented during the pandemic, and really appreciate you as individuals. You've contributed so much. As a reminder, this webinar was sponsored by Salt Lake Chamber's Roadmap to Recovery Coalition, and will be available on our website following today's live presentation. If you'd like to learn more about how you can get involved, please visit slchamber.com. Thanks, everyone, and have a great day.